Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. As you can see, we are out of the studio today. We are at the Minnesota State Capitol at the Office of African American Health's inaugural celebration for the launch of the office, and also to support the PBH, the public grant recipients that were here. So many different avenues were covered, from education to healthcare to gun violence. There's been so many different wraparound services that are going to be offered as we head into the fall for the launch of this office. It's going to be a time to be able to hear from the executive director, the commissioner, as well as a specific new gentleman here, Mr. Halkano Arturo, who is here working and is of the Oromo community. This is going to be a really good episode, and it's going to be some really great information shared amongst the community. Stay tuned.
All right, we're going to get started in a few minutes. Welcome, everybody, and if everybody can come on in and gather in and get yourself a comfortable seat in the shade. We are honored that you are here to celebrate with us today. The Office of African American Health. Come on, this is a celebration, y'all.
For coming. Enjoy.
Yes, we know that our health is important. We know that our health matters. And so we are grateful that you are here to participate in a historical event today. And who's here is supposed to be here. And so we're grateful for that. Well, as you know, we start our celebrations in honor of the folks who went before us, because we know that as we stand on these Capitol steps, that we want to honor those, the indigenous land. We want to honor those who have built this nation, and starting with our Minnesota State Capitol. And so we want to start off by lifting our voices and singing. And so if you would do the honor of standing, you don't have to worry about singing. I got that part. But if you would feel free to stand on your feet as I sing all three verses in honor of the beautiful people that we hail from. And I am yours truly, Jamela Pettiford. I am your MC today. And I will be, thank you. Yes, that's right. Yes, you can look me up. I'm Googleable. But I'll be bringing in, exactly right, I'll be bringing in our ancestors and our people with us as we celebrate. Lift every voice and sing till earth and heaven ring. Let it ring with a harmonies of liberty. Let our rejoicing rise high as a listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of our new day begun. Let us march on till victory is won. Stony the road we've trod, bitter the chastening rod, felt in the days when hope unborn has died. Yet with a steady beat have not our weary feet come to the place for which our Father sighed. For we have come over a way that with tears has been watered. And we have come, treading our path through the blood of the slaughtered. We're out from the gloomy past, till now we stand at last, where the white gleam of our bright star is cast. God of our wearies, you've been the God of our silent tears. Thou who hast brought us thus far on our way, thou who hast by thy might led us into the light, keep us forever in your path, we pray. Lest our feet stray from the places, our God, where we met thee, and lest our hearts, drunk with the wine of this world, we forget thee. We're shadowed beneath thine hand, and may we forever stand true to our God and true to our native land, our native land. Yes, lift every voice. This is a celebration, y'all. Yeah, we came to celebrate. And so we are honored to have you here. You can now rest your feet and take a seat. Take a seat. Well, we're going to lead you on this journey of this historical day. And you know, we have some great folks, some beautiful folks in the house. And we're going to go ahead and get started with our speakers. And we're going to start first with our commissioner. For our first speaker, we will hear from an exceptional leader, an equality champion, the Commissioner of Health for the state of Minnesota, Dr. Brooke Cunningham. Come on, y'all. For Commissioner Cunningham, community engagement is not just about the activities, but it is about the accomplishment and accountability. Commissioner Cunningham is a community advocate and with lived experience of historical and systematic oppression, whose dedication has led to the establishment of the Office of African American Health. Now, come on, you know what to do. Please join me in welcoming our beautiful Commissioner Dr. Brooke Cunningham, everyone. Yes, many blessings.
Good afternoon, everyone. It is such an honor and privilege, and I am thrilled to be here with you this afternoon to celebrate this office. This is a significant milestone in Minnesota's public health history. Thank you. With the establishment of the Office of African American Health. We know that health disparities in African American communities are numerous and significantly impact the overall well-being and life expectancy of our community. We know that they arise from a complex interplay of socioeconomic, environmental, and systemic factors. Now we know the statistics, right? And those of you who have heard me talk before know that we're tired of just recounting the statistics, right? And forgetting about the people, the real people who those statistics represent. We know that African Americans have higher rates of chronic conditions such as hypertension, diabetes, and obesity. We already know that than other Minnesotans. We know that African American women experience higher rates of maternal mortality and complications during pregnancy than other Minnesotans. We know that. We know that our babies have higher mortality rates and are more likely to be born prematurely or with low birth weight. And we know that we face higher rates of HIV infection and other sexually transmitted disease due to limited access to healthcare and prevention services. And I lift that up because what people will tell you when they look at the statistics is that those numbers are because something's different about our bodies, right? That something is wrong with our bodies, that somehow our bodies are naturally predisposed to disease. That's not what it is, right? We know that it's not because we are innately unhealthy, but because we live in unhealthy environments, unhealthy neighborhoods, our position in unhealthy, untenable social positions and locations, and that is what causes stress and harm and chronic inflammation, right? Leading to elevated cortisol and hypertension and diabetes, right? And all the downstream sequelae from those elevated stressors over a life course. So this office is to turn that corner in a new way. Now we know that we have programs across the agency in all of those areas, in the Minnesota Department of Health, in all of those areas that I just mentioned. But the Office of African American Health will help take a new lens in partnership with our programs. Again, put community at the forefront, develop some new solutions, push the policy levers, and engage in a new way. The establishment of the Office of African American Health is the culmination of extensive hard work, dedication, and collaboration. From envisioning the office's role and impact to crafting the legislative proposal, from steadfast advocacy across all spheres to successfully navigate the challenges up to the finish line, every step has been taken with a sincere commitment and the goal of creating lasting change in our public health system. Because we need change for people. We need change for Black Minnesotans. It is overdue. It is about time. And this office will shepherd a new approach. It is, again, a reiteration of our collective commitment and effort to advance the well-being of all Minnesotans. I often say that I am, tired of saying the refrain that we live in a state with some of the best health care in the country and some of the best health outcomes in the country, but not for everyone. We got to change that. So the office is more than a new department branch. It is a beacon of hope and a firm commitment to equity. It embodies our strategic efforts to tackle the unique challenges and disparities that African American communities face statewide. The creation of this office addresses generational health inequities and represents our dedication to overcoming generational trauma, racialized health disparities, and dismantling systemic barriers to improve health outcomes. As we launch this office, we look forward to implementing innovative health programs informed by community voices and specifically tailored to the needs of African American communities. Now, when you look at the numbers, that might sound ambitious, but I want you all to know it's achievable. It is achievable. We can, with partners, eliminate racial health disparities. We've got to believe that. We've got to believe that, and we've got to re-up our commitment to do that in the state of Minnesota. So let this day serve as a cornerstone upon which we build a healthier future for every citizen in Minnesota, regardless of their race. Together with the dedicated staff of the Office of African American Health, the staff in the Health Equity Bureau, and certainly everyone in our whole agency, right, and the support of the community, we can transform the landscape of health in Minnesota. So in conclusion, let me just extend my deepest gratitude first to you all for being here. for believing that this office can help us do better. Thank you all for turning out. We can turn up. But thank y'all for turning out. I know that the history with MDH can be mixed, right? I know that. But what this office represents is an opportunity for us to continue to do better, an opportunity for us to listen better, an opportunity for us to implement better, an opportunity for us to be more inclusive, more radically inclusive than we have been. So I appreciate you all first for not giving up on MDH, for not giving up on public health. So thank you all for being here, and also let me just extend gratitude to everybody who worked with us, with me, with Dr. Tora, to really get this office in place, who raised your voice in 2023 legislative session to help to make it happen. We are going to turn this vision into a reality. We're going to stop just with the talk. We're going to impact those numbers. Your hard work, your dedication, your commitment to justice and equity will help us pave the way for a brighter, healthier future. Thank you so much for being here. Thank you for your commitment, for your passion, for your partnership. Let's continue to work together, learn together, lean on each other. Let's lean into something different, and let's grow together towards a healthier Minnesota for all. Thank you all so much for being here.
We know in being radical, many times you have to stand alone. But we are asking for you to join in being this radical understanding that this can be done. We know that one person cannot do it. But we know that when we all chip in and we all are speaking positive about it and we are driving in with our questions, we are listening to understand, we can connect all of the different areas of our power. And as we connect together all the different areas of our power, all of a sudden our bodies start to radiate differently. And that's what time it is. And so I'm thanking you, Dr. Brooke Cunningham. We know to do this work many times, you feel like you're walking alone or folks are not all the way 10 toes down with you. We want you to know that this is something that matters to all of us, the bodies and the health of African American people, knowing that it is systemic and historical, and understanding that equity means that you care about me like you care about yourself. Mm-hmm. And so we thank you that you will do that in this effort. Thank you, Doctor. Now, we would like to invite our Health Equity Bureau leader, Assistant Commissioner Dr. Helkino Tura. Dr. Helkino Tura is a tireless advocate for health equality, who has been instrumental in establishing the Office of African American Health. He believes that meaningful community engagement happens only when we align ourselves. I agree. With our policies, our resources, and procedures to do what is meaningful to the community. That's the caveat. And so I would like you to welcome another trailblazer in this mission. Please join me in welcoming Assistant Commissioner Dr. Helkino Tura.
Thank you. Yes. Well, really hard to follow, but thank you so much. Hard to follow, Commissioner Cunningham. The energy, the celebration. I love this day. If there is a day that makes meaning in everything that I do, it's this day. Thank you. So let me say that on behalf of the Health Equity Bureau at MDH, I would like to extend a warm welcome to everyone joining us today to celebrate the establishment of the Office of African American Health at MDH. Did you hear me? The establishment of the African American Health at MDH. Today, we gather to celebrate a monumental achievement, the celebration of this office at MDH. This is a momentous occasion marking a significant step forward in our ongoing commitment to equity, justice, and removing racial disparities among an African American community. For too long, African Americans have faced disproportionate health challenges. These challenges are rooted in a systemic inequity, a structural racism that have persisted for generations. But we are not naive. We're not saying that just by establishing this office, this generational inequities, systemic operation is going to go away immediately. We're not saying that. We're not naive that the things that is ingrained in our social fabric is going away just by establishing the office. But I would say that this office represents the hope, the change that we're aspiring. This office represents that we as a state government saying, we hear you, we listen to you, we're here for you, not for us. That's what it represents. It is also an encouragement for us to do something in a community in a meaningful way. It is also a testament to our dedication to equity, to really meaningfully listening to the community and engaging community in an authentic way, to addressing the generational disparities in African American Minnesotans. So I really want to take this time, because I was not supposed to speak a lot. I want to take a time to really thank people and honor individuals that labored with us throughout this process. So the first person, as you've heard, first and foremost, I don't know if you can hear me. I extend my deeper gratitude to our amazing leader, Commissioner Cunningham. Dr. Cunningham has been a steadfast advocate for this initiative, always reminding us it is time to show commitment. It is time to show accountability to the community in every conversation. Commissioner Cunningham advocated for this initiative, always reminding us that. Her leadership and vision has been instrumental in bringing us to this point. Once in a while, Commissioner turned around and say, you know what? I didn't do much. There are a lot of things in the community. There are a lot of problems in the community. And I've been saying that consistently. Commissioner, look at us. Look at your team. Look at what we're doing. We're doing this because you're our commissioner. To have that privilege, to say, look your leaders in the eye, and say, I'm doing what I'm doing. I'm doing what I love to do, what I'm passionate to do because of you. It's a privilege you can get once in a lifetime. We know that. We know that our community is struggling. We know that. But I want to say that at the end of the day, we lean on our community. We go back to our community. So when we're here, we're not going to forget our community, because we fall there. We fall on you. We're not going to forget you. So thank you, Commissioner, for allowing me to do the things that I'm passionate for, and then to live the life I want to live to do the things that I want to live for. Thank you. I also really want to extend my appreciation to legislators, our lawmakers, for really considering this, for seeing this, establishing the office as a way to meaningfully engage with the African American community and the struggle they have. Thank you for taking that on. So I go down the list, and then I want to say our budget team at MDH for working day and night, making sure that we present sound and a meaningful budget, sitting with the legislators day and night. So particularly Shar, I don't know if you're here, Shar. Raise your hand if you're here. Thank you for your contribution to this work. Our legislative team has been amazing. Our legislative team that led by Lisa, they showed up with all commitment and determination, day and night, to convince lawmakers, to show the data. They really made sure that our voices are heard, our needs are recognized by legislators. So thank you for that. So finally, I want to thank Scotty. Scotty, are you here? Scotty is the director of our Office of Diversity, Equity, and Inclusion. Thank you for stepping up and helping me in hiring staff, leading the office until we onboard our new director, supporting the establishment of this office. So your name will be remembered in the history of this office. Scotty, thank you. So the entire Health Equity Bureau and MDH staff, thank you. Your passion, dedication, and commitment to this cause inspire me every single day. Hard to do. Doing equity is not an easy thing. We are engaged in a socially and politically sensitive environment. Without our team dedication and support, we couldn't have done this. So thank you. Together, we will work to create healthier, more equitable future for all communities in Minnesota. So thank you. So this office is more than just a new part of MDH, as the commissioner was saying. It is a symbol of our dedication to justice and equity. It will address the unique health need of our communities through meaningful community engagement. I will repeat, I strongly believe that meaningful community engagement only happen when we align ourselves, our policies, our resources, our mental model, our mind, the way we think about our community, align that with what is meaningful to the community. It only happens. We can't talk day and night community engagement unless we align our policies, resource distribution, our procedures with what is meaningful to the community. Nothing is going to happen. At MDH, we're committed to do that. This office is a testament to that. But we can't do this by ourselves. We need state leaders. We need community leaders. We need healthcare providers. There are so many discrimination happening in different spaces. We need education leaders. We need county leaders. We need faith-based organization. We need community-based organization for this vision to be reality. It takes all of us. You can already tell that I come from Africa, so it takes village. Right? It takes village. We need the village in this movement. This is not just an office, it is a movement, and we need the village. The village that we lean on, the village that we listen to, the village that shows us a way. So it takes all of us. So now my 3-page of speech is out of the way. I am proud to introduce the person who is going to take this aspiration, vision, hope we have for this office forward, Devana Carter. Director Carter is a transformative leader. Devana Walker, sorry, Rocker. Sorry. I say Scotty Carter and then I went with that. Devana Rocker. I apologize, Devana. Director Rocker is a transformative leader with a passion for the advancement of Black community. Her lived experience and a community-focused lens fuel her to challenge the systemic barrier disproportionately impacting Black communities in Minnesota. We are so lucky to have her join MDH and lead the growth of this historic office. Please join me in welcoming our new director, Devana Rocker. I'm right the last time.
Woo! There we go. Hey, village. Hey, family. 1 second. Let's see. I have a speech. I wrote it. It's really nice. I have to find it. There we go. It's coming. Appreciate the patience, you all. Thank you. All right. Whew. Y'all, it is such an honor to be here with you all to celebrate the establishment of our office, the Office of African American Health. Focusing intentionally on multi-generational African Americans, American descendants of slavery, Black folks. Oh, I'm by myself today? Okay. All right. For over a decade, I have dedicated my career to advancing equity in the Twin Cities metro area, and I cannot understate the pride that I have in being able to stand before you all today and radically and explicitly name who I am called to serve in this life. So thank you. Thank you for having me. I'm incredibly grateful to those who were in position before I who saw fit to create a space such as this to honor our people. As the fearful leader, and I say fearful on purpose because I am terrified of some of the disparities that we are facing as a community. I am committed to amplifying the community voice and challenging those systems to implement practices that improve our outcomes. So I'm gonna go a little off script here because this is relevant. I wanna share with you guys, today as we were here, we were setting up, everybody was mixing and mingling, and one of our assistant commissioners, I will not say their name, but they walked up to me and they said, they had flowers and everything and said, "You're the woman of the hour, correct?" And I said, "No." And she looked kind of funny. I was like, okay. And walked off. And everybody was like, no, that is her. That's the woman of the hour. And I said, well, no, I'm not. Because today is not about me. It's about this office. We're not here to celebrate me, but celebrate that we're all here for a joint purpose. So you all heard from some wonderful speakers already, and our commissioner, Dr. Brooke Cunningham, our assistant commissioner of the Health Equity Bureau, where our office is housed, Dr. Hawken Otora. But there's also a few people that were heavily involved in the birth and infancy of this office that I want to acknowledge. You may hear a couple repeat offenders. Bear with me. So first, I would like to acknowledge Director Scotty Carter. Scotty, wave to the people. There he is, over there. So Scotty is my brother in arms. He is the director of the Office of Diversity, Equity, Inclusion, and Belonging. He did me the gracious honor of warming my seat as interim director for the Office of African American Health. So he was in this role before I, serving as interim director, and I appreciate you, Scotty, your leadership, your commitment to not only the office, but to our community. And I applaud you for that, and I thank you. I also want to acknowledge Miss Nancy Lee. Miss Nancy is sitting right back there, the beautiful lady in the sunglasses. Miss Nancy was here at MDH, and she took it upon herself to lead the work of the Office of African American Health. The work that we are doing today, we could not have done without her being here to lay that groundwork. And so, Miss Nancy Lee, we appreciate you. Again, your leadership as well and your commitment to the work of the Office of African American Health. So thank you. And next, I want to acknowledge my team. I got a bad team, y'all. I got a bad team. The grant managers for the Office of African American Health, they're sitting right on the front. If you all will please stand for me. I have Miss Sandy Johnson. I'm just going to say first names. Miss Sandy, Miss Nyla, Miss Endurance, and Mr. Jordan. These individuals have worked tirelessly since they got here. And I know you guys haven't gotten all of the backstory of the office, but we all came in kind of hot, okay? Came in very hot. And when I say these folks hit the ground running, no complaints, just getting the work done. Well, we family, right? There were some complaints. There were some complaints, but it didn't impede the process. We continued to move forward. And I can say these individuals here have a heart for our community in this work. And I want to publicly acknowledge you all and say that I appreciate you all individually for your contributions to this office. I also want to share just a highlight of the work. We have 14 community-based organizations that we will be partnering with. We have our first round of grantees for our Paths to Black Health grants. And these 4 pioneered that work, and they got they collaborated with these different organizations, and they're working with them to ensure that the projects are carried out. So I thank you all, and I appreciate you, and I'm proud to work with you all every day. So the Office of African American Health will operate both internally within the state enterprise and externally with the community, focusing on the root causes of health disparities via the social determinants of health domain areas. As we all know, inequities have a domino effect. One thing affects the other, and it just keeps going until all of our bodies and minds and circumstances are impacted. As we partner with state and community to modify and launch initiatives, rest assured that we are committed to the progression of the community and prepared to disrupt the practices and systems perpetuating those disparities. I am honored to have been chosen by MDH and God. Reverse it. I am honored to have been chosen by God first, and then my leadership at MDH, to lead this work. This is a big responsibility. I do not take it lightly. I appreciate the support, and I look forward to a Minnesota where Black people can live healthily. Thank you all for coming. Enjoy.
Well, I told you it was going to be historical. And I told you that we would all need to join in on this effort to make these changes. And so we thank you from Dr. Brooke Cunningham to Helkino to now our beautiful Devonna Rucker. We are excited to have all of our frontline staff that are making sure that everything is being taken care of within the office. We know that it takes all of us, all hands in, to make sure that everything gets done. And so we thank you for being a part of that effort. Let's give another round of applause. Seriously. Well, as you know, many times when we call unto the entities to help us, we use the drum. The drum represents the heartbeat that flows in each and every one of us. And what's so beautiful about that heartbeat is that it's offbeat, on beat, in beat, out of beat, and all them beats make all of what it is that we do. And so we are inviting all them on beats and off beats and up beats and down beats to join us today with our TKO drumline. They are a local drumline here in Minneapolis. They're going to help to call in and bring in all of our traditions, and the drum being one of our main communicational traditions. And so we thank our drumline for being with us. Give them a round of applause as they come. TKO drumline. TKO, yes, TKO, drumline. What a beautiful performance. Let's give them one last round of applause. We're so proud of you, young people. We are so proud of you. And what's so beautiful about having a drum line like this is in line with our mission. It is in line with what it is that African American health is about. It is about having healthy young people that are actively doing something that matters to them. Give it up for that. That's good health. When you are participating physically in something that brings you joy, brings you to community, brings you to that accountability we were talking about, because that brother that was calling out those calls, I know for a fact he holds those young people accountable. And we could see that in the discipline of their performance. And so we thank you, Drumline, for being here. Well, you know, I get a chance to call our beautiful Dr. Brooke Cunningham back up here because at this time, I want to invite her back to introduce our next speaker. So would you give a round of applause to our Dr. Brooke Cunningham as she comes on back up?
It's a fabulous day. It's a fabulous day. I love it. Thank you all for again being here with us. And it is my distinct honor to introduce our next speaker. We will hear from our Lieutenant Governor, Peggy Flanagan. The Lieutenant Governor is a distinguished leader and advocate for the community, working tirelessly to ensure that every voice is heard and that everyone thrives. We are especially grateful for Lieutenant Governor Flanagan's leadership and support in the establishment of the Office of African American Health, Please join me in welcoming a visionary leader and champion for the community, Lieutenant Governor of Minnesota, Peggy Flanagan. Thank you. Thank you so much.
Well, good morning, good afternoon. It's been a long day, y'all. It started like 5:30. Well, and I am so happy to be here. And the thing that I heard as I walked out the door before I even saw y'all was the drums. And that is, it's just power. It is power. There is power and there is healing in drums and in our music. So thank you so much for being here on the front lawn of your house. It has been a long time coming, this office. And I know that there are a lot of people who have dreamed about this day and what was possible, and so many hands who work together to get this across the finish line. And it's oftentimes when we're on Minnesota's front lawn that I think a lot about who has been welcomed here and who has not been welcomed here. My job as the lieutenant governor is one, like, be ready. There's like two other things on the list, but and one of those is to be in charge of the Capital Area Architectural and Planning Board, which sounds very exciting. I know it does, but it is, because part of my job is to make sure that people feel seen and heard and valued and welcomed in this place. And little by little, step by step, we are getting there. And so this celebration today on the front lawn is one of the ways that we make sure that people know this is your house and you belong here. And in the last handful of election cycles, we also have seen more people who come directly from the community who are able to speak on behalf of the community as decision makers in this building. And that changes things too. And we see folks from community in important roles like our commissioner, Dr. Cunningham, who just gets it. And when we have these conversations, you don't have to have the preamble about what's happening in the community. You can just get to the conversation about what needs to happen. And that, I think, is what this office is all about. Wanting to make sure that we know that solutions come from the community. Ensuring that we have the data because we measure what we care about, because then that spurs us to take action. And once we have the data, we cannot turn away. And then we have solutions. And so I am eager to get to work on many of those solutions, because we deserve, and our young people deserve, to live in a state where who they are and where they come from does not predisposition them to diabetes or heart disease or to addiction. They simply get to grow up and be themselves and be in a place where they get to thrive and live full and beautiful, healthy lives. In my community, in the Native community, one of the most alarming things I have ever heard is when a young person said to me, "When I get diabetes." And so, you know, my dad walked on, and he walked on after complications with diabetes. And so when I think about that, I don't want any of our young people, that sentence to come from their lips. It should be, when I am the governor of Minnesota, right? When I am the next commissioner of the Department of Health, when I am a doctor, when I am a teacher, when I am a lawyer in this community, when I am someone who is a caretaker, and I know that I will grow up to be an elder because we have changed. We have changed the factors, right? To be a place where we can really thrive. And when someone goes to the doctor, they are seen and heard and valued and protected and believed. And when someone tells you that they are in pain, you help them to heal and to treat that pain. So I am just honored and humbled to be a really small part of this. But I just want to be clear, this is just the beginning. Right? The work of this office is to bring new ideas and new solutions and new policies that we have to get across the finish line, right, Representative? That we have to get across the finish line in upcoming sessions. So Thank you, Chimigwech, for all of the work that you have done to get us here today. And I will thank you in advance for all of the continued work that we will do together to advance the health of African Americans in the state of Minnesota and let folks look to us for how to do this in a good way and how to do it right. So thank you so much. Appreciate all of you for being here today. The hazards of jewelry, right?
All right. Well, you know, when our community comes together to support each other, things happen. And so we want to thank you, Peggy, for being here and for your efforts. And so we're going to move right along. We have had a beautiful time together. This is our last speaker. And I'm grateful because these days will be edged in our mind not only as memories, but things that we actually have been a part of. When we look into the history of Minnesota and the health of all of her comrades and constituents and folks that have been members, advocate members of this state, going all the way back to these golden horses that were built and put together by my great-great-grandfather, Cassaville Bullard. It's an honor to stand here. It is. It's an honor to stand here. And it's an honor to be a Minnesotan. I think many people underestimate us, especially Black Minnesotans, because of all of the looming things that we hear. However, we are great. We are excellent. We are thriving. We are amazing. Wherever we go, they want to know, where are you from? And we tell them, oh, we're from the Twin Cities. We're from Minneapolis. We're from St. Paul. Oh, right? And a lot of people, they know Prince or they know Time or they'll know Jimmy Jam and Terry Lewis, but we're here too. And so we are here to welcome one of our office's first community partners and a receipt of the first round of the Paths to the Black Health Funding, Reverend Jessica Jackson, affectionately known as Pastor Jess. Pastor Jess is the founder and the head of school at the Morning Glory Montessori, the first ever all-boys, faith-based, Afrocentric Montessori early childhood education center here in the Twin Cities. Come on now, y'all. She is a former attorney and a lead pastor of Impact Living Ministry Church. Please, a beautiful soul, a person who is dedicated to not only our children, but to the building of the minds and the souls of our people. Please join me in welcoming Reverend Jessica Jackson, everybody. Yes.
Wow. I can't believe I'm coming last, especially after Drumline. That's not really fair, Devonna. You didn't tell me about that. Good afternoon. Good afternoon. What a beautiful day and gathering. I want to thank you, Director Rucker, for your gracious introduction, for the introduction and the invitation to speak today as a representative of the Office of African American Health's inaugural cohort of grantees. I am humbled and honored to be amongst this select group of statewide community servant leaders chosen and committed to pave new paths to health and wellness for Black Minnesotans. I wish there was time to hear from each and every grantee organization, which we were able to do at our orientation last week. And it was so inspiring and impactful. As each voice was uplifted and passionate vision was shared, I felt increased hope in the power of our collective, creative, and collaborative wisdom to overtake the complex challenges facing our community's health and wellness. Thank you, fellow grantees, for who you be and all you've done leading up to this moment. The struggle for our own health is real. Sometimes we're leading while bleeding as we fight for our community's wellness. Believe me, I know, because as they say, I don't look like what I've been through. But we're here today, together, and I genuinely look forward to building community with all of you. Thank you, Lieutenant Governor Flanagan, Commissioner Cunningham, Dr. Cunningham, and Assistant Commissioner Dr. Tura, for your courageous leadership, your presence, and the untold ways that you show up every day for Black Minnesotans and all Minnesotans. This truly is an historic moment for the African American community in our state. Thank you and the 2023 legislature and everybody that Dr. Tura and everybody thanked for standing on the right side of history, especially at this moment. And Director Rucker and OAAH grant managers, and I'm going to call you by name, Miss Endurance, Mr. Jordan, Miss Nyla, and Miss Sandy. I'm confident that I speak for all 14 grantee organizations in extending heartfelt gratitude for everything you've done thus far to make this day possible, and in advance for all you will undoubtedly do in the weeks and months ahead to help us fulfill our important assignment as the first ones, not the last, but the first ones charged with the awesome responsibility and opportunity of making the vision for this new office a transformative reality for Black Minnesotans. We take this unprecedented gift of collaboration with OAAH seriously. And we honor the call to meaningfully serve our communities with moral integrity and Black excellence. Now, I was told that the theme of this event was simply joy and celebration. And I think that's true. We've experienced that so far. And hearing that, it brought to mind the ancient sacred text that exclaims, "Weeping may endure for a night, but joy," some of y'all know it, "comes in the morning." Can you turn to a neighbor and say it's morning time? You know, I know Lieutenant Governor, she had to leave, it seems like, and she kind of slipped up and said good morning, but that was prophetic. She didn't even know. It's morning time. Say it's morning time. I know it's technically Friday afternoon, and I'm the last speaker standing in the way between whatever's coming next. Okay. All right. Don't start something up in here. It's morning time for Black Minnesotans. As a native of Minnesota born in 1965, y'all do the math, the gray is real, and raised in North Minneapolis, I have both experienced and witnessed decades of nights of weeping by, for, and about Black people, my community. Weeping over seemingly intractable health disparities and premature deaths. Weeping over oppressive caste-like systems that keep Black backs pressed against the wall. Weeping over what prophetic elder Marion Wright Edelman called the most dangerous place to be, the intersection of racism and poverty. Weeping over pernicious opportunity gaps and persistent generations of inequity. Weeping over the resulting dangers of hopelessness. For as John Hope Bryant said, the most dangerous person in the world is a person without hope. Because hopelessness leads to self-destructive, domestic, and community violence. And what weighs heaviest on my heart and mind is the weeping or maybe not enough weeping for our children. Our reward, our heritage, our very hope and literal future, who are dying swiftly on the streets or experiencing slow spiritual deaths in classrooms as early as preschool, that ushered them into the prison pipeline and a lifetime of lost potential. All this weeping has left us diseased, sick in our souls, unhealthy, not well or whole, mentally, emotionally, physically, economically, and spiritually. Weeping has endured for a night. And the night for Black Minnesotans has endured way too long. But it's morning time. And joy is here. Can you turn to another neighbor and say, joy is here? With the creation of OAAH, a new day is dawning. Hope is rising, and joyful possibilities and community-led solutions are emerging, like our school, Morning Glory Montessori. As the first of its kind locally and nationally, Morning Glory's mission is to be a safe, nurturing refuge, an educational environment that affirms, inspires, and empowers Black boys to reach their fullest potential and grow into successful, compassionate, joy-filled Black men, thus dismantling the cradle-to-prison pipeline. Amen. At MGM, we're dedicated to holistically nurturing African American boys aged 3 to 3rd grade through an original curricular confluence that we call FAM, that stands for Faith, Afrocentric, Montessori. Faith through the lens of liberation theology and nonviolence, beloved community practices. Afrocentric through African American culture and history that connects to our people and collective story. And high fidelity Montessori pedagogy expressed in a beautiful, come see it, culturally responsive, prepared environment. I am so blessed to have my husband, Reverend Dr. Timothy Jackson, here, who will serve MGM's families as a trained Montessorian and our director of faith-informed pedagogy. I wouldn't be doing any of this without his encouraging support. And he just got that Reverend Doctor, y'all, so you got to make sure and give him some love. At Morning Glory, FAM is also an endearing abbreviation for family. With the child and family at the center, Morning Glory will provide a holistic, intergenerational community of support focused on empowering Black boys, their families, and the Black educators who serve them, while enhancing the social determinants of healthy early childhood development, literacy, parent engagement, and community connections centered on African American elder volunteers. The vision for MGM has grown through an organic community-based process over the past 5 years. But the original vision was conceived over 30 years ago in my mother's heart, an early childhood pioneer and trailblazer in North Minneapolis, dating back to 1969. Her name is Ruby L. Hughes. There's a street over north named after her. She's the founder of La Crèche Early Childhood Centers. Decades ago, when I was preparing for law school, she was converting one of her traditional preschool classrooms to Montessori. Unfortunately, though, my mom's premature death as a victim of domestic violence aborted her vision to provide poor Black children access to the beauty, wonder, healthy, and holistic development that a Montessori education can provide. Now, years later, After a full career as an employment attorney and ordained minister, I stand before you humbly with the baton in my hand to finish the race that she started. And after 5 years of planning, pressing, praying, and preparing, we are opening our doors this fall with the foundational, collaborative support of OAAH. It's morning time for black boys at Morning Glory. And I pray that before long we'll expand our reach to little girls as well. So it's morning time for black Minnesotans. And through the work of OAAH, I'm going to get that right, joy is truly coming. We're pressing toward the day where blacks, health, and joy in the same sentence without disparities will be the norm. We're forging a new path forward, each of us grantees in our diverse ways, reflecting our unique justice imagination and sacred missions. Different journeys, but one mind, heart, and goal, all moving, pushing, and pulling in the same direction towards increased health and wellness for African Americans in Minnesota. I believe most of what we need is within us. The rest of what we need is amongst us. All of us, working together, walking together. And as I prepare to sit down, I'm not like my husband where I have 2 or 3 closings. I just have one. An African proverb says, when you pray, move your feet. Let's continue to pray and move our feet and our hands and maybe some mountains when necessary until we are liberated from debilitating disparities and living in the health and well-being we were created to. I know what it means to start up, to be a startup like OAAH. We need extra grace because trailblazing isn't easy. Giving birth to unseen dreams in response to silenced cries and deeply rooted community needs can be daunting. But we're here today, together, proof that nothing, say nothing, is impossible. So let's do this. Thank you. God bless.
Well, this is what the Office of African American Health is all about. It's helping to build and put together organizations that will do the frontline work, that will work with our community and our young people who are suffering the most. And so we want to thank you for all of your efforts. And we, again, stand behind you in all the things that you are doing to make changes at the Morning Glory Montessori. We will look you up. We will support you. We will tell other young families who have young boys who are wanting to get that level of instrumentation and celebration and self-love and all of those things that I know that you're going to impart into our children. And so let's give another round of applause for our dear Jessica and the ways that we support you. Well, guess what? We have made it to the end. I don't know if I told you, I am Jamela Pettiford. It's been an honor to be able to walk you through this celebration. Yes, thank you. And so we want to make sure that we give some shout outs and some thanks, because a lot of times the behind the scenes stuff does not get recognized as it should. But we know that if it wasn't for the behind the scenes folks that make sure that things run smoothly, it would not have ran as smoothly as it did today. So we want to make sure to say, Stephanie and Andrew, yes, we didn't forget about y'all. We want to thank you for all the copies you made, all the phone calls you did, the emails you had to send, all the behind the scenes stuff. We heard that you had to do different licensings for these tents to make sure that everybody was cool and that no one had the sun beating on the top of their head. And so we want to thank you, Stephanie and Andrew, for all the ways that you went the extra mile. Let's give them another round of applause. Seriously. Thank you. Well, before I let you go, we figured that we would go ahead and document us doing our little dance together on this front concrete area. And so, are you ready to play our jam? Who's playing our jam? Oh, it's our dear brother Jordan. Now, once you hear the jam being played, okay, whether you think you have rhythm or not, okay, we are going to want you to come up and do a little bit of the electric slide, okay? Yes, take the clip out of the hair, my dear beautiful sister. We seen you. She was getting ready, putting her hair together. But we would like you to come on up, and we would like to document how we gonna step this before I let you go into the Capitol here and make sure that the Office of the African American Health is heard loud and clear, that we are here to change lives one step at a time. See, there it is, before I let you go. And again, I am yours truly, Jamela Pettifor. Look me up again, I'm Googleable. Let's thank all of our players that are in the room. Dr. Brooke Cunningham, Dr. Hiltora Tura, our dear Divina Rucker. We have our beautiful Jessica Jackson, and all of our funders that do that daily work. We thank all of you all for coming today. Thank you so much for being a part. And before we let you go, come on up and dance. Yes, come on down. All right. Now don't hesitate. Come on out here now. This is a multicultural thing. Yes, get on out here, everybody. Yes, we want to see you dance a little bit. Yes, come on. Jordan's gonna lead us. Jordan knows how to do this. George knows how to do the electric slide, don't you, Jordan? All right. Just like happy. This you can bear. Come on.
All right. Let me see if I can get some more volume on here.
We had a what is this?
There you go. I
Unfortunately, that is all the time that we have for today's episode. And I hope that something that was said today you have found informative and or inspiring or educational. This office launching is going to give so many members of the community a chance to plug in and tackle a lot of health disparities that are affecting African American and Black citizens of the United States as well as of Minnesota. This is going to be a wonderful opportunity for us to make sure that we are taking care of our health and each other. Please make sure that you stay tuned. As always, I am Anna Orr, and this is Community Connections airing on OROMIA 11.